each wave, as well as whether there is concerted fast-tracked response. Now, owing to this uncertainty surrounding COVID-19, it is imperative that governments and non-state actors work together to develop systems that provide for proper epidemiological planning and management, especially where health systems are weakest. It is for this reason that the African Population and Health Research Center, in collaboration with partners, have come together to establish a data hub for COVID-19 data in Kenya and Malawi. And that is what we want to discuss, embracing AI technologies in healthcare. Well, let's meet our guest. We begin with my immediate left, who is Sam Makau. Now, Sam is an accomplished regional communications and advocacy expert based in Nairobi, Kenya. He has successfully worked on critical advocacy campaigns like the Global Fund's 7th replenishment and the 3rd Africa Parliamentary TB Summit. Now, Sam has also collaborated communities with creative professionals, including musicians, comedians, and storytellers, to advocate for the elimination of TB, HIV, and malaria. As the communication chair of the Coalition for Health Research and Development, Sam contributes to decision-making processes, shaping the coalition's strategy and enhancing communication efforts. Currently, he works as a lead consultant at Uwitu, a communications firm based in Nairobi. Welcome, Sam, and thank you so much for joining us. All right, let's meet Henry Owoko, who is next to Sam. Henry is a policy evaluation and research professional with 7 years of multidisciplinary experience. He's keen on leveraging data to inform policy and decision-making. Presently, Henry is a monitoring evaluation and research officer at Aphrc and also doubles up as a data protection officer at Aphrc and is responsible for institutional compliance with data protection regulations in the countries that African Population and Health Research Center works in. Well, welcome, Henry.
Thank you.
All right, let's begin this conversation. And who wants to start the conversation off? Henry, yourself?
We can start with Aphrc.
Aphrc. All right, so let's start with that. Who are you and what do you do?
Yes, so African Population and Health Research Center is an African-led, African-based research and policy institution.
Yeah.
Currently, it's headquartered in Nairobi, but we have a regional office in Senegal, but a million other offices across the continent, right? And Aphrc we're actually celebrating 20 years of existence recently. Right now, we've taken the celebration. So we did that in Kenya about a month ago. We've taken the celebration in Senegal.
Okay.
I think this week they are celebrating 20 years of existence as Aphrc. And I think the core to Aphrc's work is that we have 4 program areas. One we call health and well-being. Here we are studying nutrition, we are studying maternal health and the likes. And then we have human development. Under human development, we are exploring issues with regards to gender, education, and the likes. We also have urbanization. Now, under urbanization, we are studying migration and population-related research. And then we have the elephant in the room, the data science programs.
Yeah.
So under data science programs, we are trying to leverage the use of machine learning, artificial intelligence in supporting healthcare delivery and the health sector.
All right. Congratulations, actually, for your 20 years, yeah? 20 years is not, it's not a joke.
Yeah, it's
all right.
Time, yeah.
All right, so coming to you, Sam. So why artificial intelligence?
Artificial intelligence is the future of technology. And to be honest, if you look at, for example, if you compare the different continents and how we have progressed technologically speaking, AI just might be the thing we need to bridge the technological gap between ourselves and other nations around the world. So AI is emerging, it's proven to work, it is effective, and it is the future of technology.
All right, but you know, when you say AI, there's so much speculation and myths around it. And here we are talking about AI in healthcare. Don't get me wrong, but to whoever is watching us and, you know, they're like, are you sure? Maybe you can just elaborate it and make them comfortable that AI in healthcare is actually a good thing. Who wants to take it, Henry? Yeah.
Let me take that and start from the previous one.
Okay.
You asked why AI. I think if you think about, and especially why AI in the health space,
yeah.
If you think about the COVID pandemic, I'm using this example because it's most recent, right? If you think about COVID pandemic, it was more of a race on how quickly can we understand the disease, how quickly can we understand its spread, and then how quickly can we come up with interventions that curb it, right? And the reason the disease betters for quite some time is because of time. Mm-hmm. Now, what AI comes to do is to reduce the space between the response time. So the type of data that we would have tried to analyze and make sense of in weeks and months, if we use the traditional statistical approaches, I think we can do that with artificial intelligence in a very short time, in a span of a day, let's say.
Yeah.
And so this means response time reduces, and it means if the disease would have spread, if without AI the disease would have spread, say, for a week, then now we only have a day. And that's why AI.
So how does it work? Maybe you can break it down for us.
Yeah, so I could use a good example of the Inspire Pitch platform. Mm-hmm. So Inspire stands for the Implementation Network for Sharing Population Data from Research Entities. And then the Pitch platform now is an artificial intelligence platform that it actually stands for, it stands for a platform for evaluating and analyzing harmonized COVID-19 data. And so what Inspire Pitched platform tries to do, it tries to pull data on COVID, not only from one source, not only from the hospitals, but also from the general population and from any other population possible. Mm-hmm. It harmonizes this data. By that I mean if, for example, a certain disease is defined differently from the different sources, we harmonize it and make it the same so that it can exist as one. Mm-hmm. And so by doing this, we are able to now process this data, this vast amount of data. So you can imagine pulling all this data from different sources. This is a lot of data.
Yeah.
And then now we process it and we are able to understand it. And that's the thing about AI. There are the two parts. There's the data part and then there is the systems part, right? And now because now we have like the analytical machines can able to analyze the analytical power of machines has really increased in the past years, right? Yep. And so we can analyze large amount of data sets, but at an even lower level that even that will take us as humans a lot of time to do.
Yeah.
And so
Okay.
So that's generally Inspire Pitch. So so by doing this, when this data passes through the system, then we are able to have very simple visualization. We can know where the disease is spreading, how it's spreading, and this allows us to design interventions that prevent the spread. We design responses that can actually curb the disease in good time.
Okay, so let's bring it back, because you've given an overview of what the AI is supposed to do, but let's bring it to the ground, practicality. So let's say here we are in Kenya, and AI is supposed to help with diagnostics and early detection of diseases, for example. And where I am, or where the disease is actually in the rural area, where there's not much technology, or there's network issues. You know how it is in the country. How then does that AI work?
Okay, so there's the Pitch platform, but if I can give one example.
Yeah.
So there's this AI that has been developed, and what it does is it helps radiologists to be able to scan X-rays better, to identify TB better.
Okay.
So all you'd need to do is just go to a facility. They would scan your chest, and they would have that X-ray. They would share the X-ray with the experts, or they have a platform that you can upload it. Then the AI will scan it, and then it will be able to give a recommendation or a suggestion saying that this patient is TB positive or does not have TB. And it's been proven to have higher accuracy as compared to radiologists. That's just one of the ways that AI can be used to improve diagnostics.
Okay. Oh, so yes, your details.
Yeah, and let me add on that. and there are different levels to artificial intelligence.
Okay.
And you're asking at the spot of collecting the data
yes,
itself, right?
Data collection.
Yeah, that's one level that artificial intelligence could be used. There is the level of the analytics, and then there is the level of the visualization.
Yeah.
And also AI has it comes with robotics, right?
Yeah.
And you've seen drones delivering medical packages, and even there are some delivery platforms that these days use drones.
Yeah.
And this is a way that, say, if we are thinking about sample collection or transporting specimen, this is an approach that could be used that is partly informed by artificial intelligence.
So how do you differentiate then AI and other health, for example, in other health services? Is it one and the same thing? It's just there to improve?
It's there to complement.
Complement is
whatever
the right word.
Is there.
Okay.
Because we already have systems that work. We have databases. We have, for example, the National Health Information System. There are already databases that exist. What we are talking about is being able to process this data better, faster, and being able to get more insights from the data. So it complements. And I think this brings us into the myths that have existed around AI.
Okay.
The first one is that AI will take over the world.
Not true.
Is
it true or not?
No, it's not true.
But
it's not true.
How technology is advancing? Don't you think that's the
I don't
direction
think
that we're
so.
heading?
Unless someone
robots?
programs it to do so.
Yeah.
I don't think so.
Then I think we watch too much TV.
Allow me to be a little bit political.
Okay.
You will find that, especially around the world, the people who are really talking about, no, you should not develop artificial intelligence. The people who are really loud in saying that are in countries that are investing billions and billions into developing AI. So what they're saying and what they're doing are two very different things. And you know, a program can only do what it is programmed to do. You can program it to find creative solutions, but it can only do that within the parameters that you've set.
Okay.
Yeah.
So we don't expect to wake up one day and find robots taking over the world.
It's true. You know, human beings have a tendency of fearing what they don't understand.
True.
And I think one thing I'd say, it's really important to create this sensitization, make people understand what artificial intelligence is all about. And if you think about it critically, you'll see there is the data, and then there is the system that processes this data. And so for an artificial intelligence platform to make a decision, it makes this decision based on some training, right? It's been trained on data.
Yeah.
And there's always that second eye that, okay, this is a platform on COVID, right? And it's been fed data on COVID for the past 10 years, and it's trying to predict how pandemics behave, right?
Yeah.
It's making that decision from this data. And there's someone, by the way, who will always come back and look at the data, look at the predictions it's making, and clean the data. And so there's always that second human eye.
Okay.
As AI does its thing, there's always someone at the back looking at, okay, how is it behaving? Is it really misbehaving? And I'll tell you, if garbage in, garbage out.
True.
You feed it skewed data, it gives you skewed decisions.
Okay.
And so, yeah.
All right. So then that means you have to partner with a lot of people, considering, data collection starts from the ground then. Maybe you can share your partners and what exactly have you done so far? How long has the project been actually, the data hub? What kind of data have you populated so far, if any?
I can say that, one, we're in the early phases.
Okay.
So we are part of a larger collaborative that looks at digital technologies and artificial intelligence called IDEA. And what we're looking at is citizen science. And this means empowering the common mwananchi to be able to participate in scientific processes. Therefore, they can be able to feed into and to be part of developing AI systems.
Yeah.
So the first study is being done in around 30 countries. And Kenya is one of the pre-study countries.
Yeah. Is it in Africa alone? Or
it's in southern countries,
okay.
Countries in the southern hemisphere, countries that are not traditional donors when it comes to financing, health, R&D.
Yeah.
So countries in Southern America, a few Asian countries, and then a lot of African countries.
Okay.
So the first pre-study is being done. Kenya is one of the countries. And APHRC is part of it, CREED is part of it as well, Aphrc Kenya is part of it, and a whole other list of organizations. And then afterwards now we'll actually have the actual study that now will be able to inform how we'll be able to develop this AI system. And the AI system that I'm particularly talking about is an end-to-end pandemic scheme.
Yeah.
So a bunch of organizations, experts from around the world came together, and this was in light of the COVID-19 pandemic. So as they were looking at it, they were saying we could do things so much better. If there were certain things in place, we could have been warned much faster.
Like,
or
for
health
example, do you have practical examples that we can pick up from? You do, Henry?
No, I just wanted to chip in on the partners.
Okay. Before we get to the partners, you can do you have a practical example? And what I mean is, for example, what we saw during COVID-19, vaccines intake. Do you know how many? Or, I'm trying to break it down as simple as it is so that we can all understand, because it's AI. And AI is a bit technical.
It is technical. Sorry, please repeat the question.
So let me go as
okay, yeah.
So if you think, and allow me to use Inspire Pitch as an example again, that if you think about what was happening during COVID, with what you've just said, vaccine intake, but then let's start with the infection, right? If we had this platform in good time and it was already being fed data, we could easily tell that, okay, right now there is an increase. So it used to take us, the reports were weekly, but then they were like, they will come on weekly, but it's for, I think 2 weeks ago, right?
Yeah.
But then with such a platform, we'll know this in real time and know that, okay, within Nairobi, Umoja is having an increase in positive tests on COVID-19, right? And then what does that mean? So if you want to take it a notch higher, you start asking yourself, where do people from Umoja go to? Most of them work in town and there, and we know this is the spread pattern. And so using such a platform, we are able to understand how the disease is moving, but then also we are able to see where it is. Okay. And so like when we are targeting interventions, we do not say, okay, we are targeting the entire Nairobi because there is high rates of COVID within Nairobi, but then we are saying we are going to Umoja because we know for sure the number of tests there, and we know it in good time. We're not going to Umoja 2 weeks later. We're going to Umoja a few days, a few minutes after we've learned that. And you see, the real difference here is this: the amount of time it takes to arrive at the decision. Yeah. And we can also easily look at within the health facilities, what is the uptake? Where are people getting more treatment? And we could start asking ourselves valid questions. Why are they going there? Is it that there is high infection there? Is it that specific facility is more efficient? And these are the type of questions that actually enable the health sector easily respond to pandemics, in the case of COVID or in the case of any other pandemic for that matter.
All right, but can this data be used for other diseases, or it's just specific for COVID-19?
So this data hub has been designed using COVID data.
Okay.
But then we are preparing for a pandemic. It's not the last that we've seen.
True.
So this is going to be, this can definitely be used for any other foreseen outbreaks in the future.
Okay. Sam, you wanted to add something?
Yes. So when we look at, for example, community engagement, one of the things that we did during the COVID-19 pandemic was engaging religious leaders. Because when you're talking about communities, especially when you're talking about a highly religious country like Kenya, you find that there is some averseness to technology and uptake of technology, and also participating in scientific processes. So what you want to do is you want to engage leaders, people who actually work with people on the ground, so they can be able to bring more people on board. And we did that, and we saw that, I don't have the numbers with me exactly, but we capacity strengthened the network of religious leaders in Kenya, in Western Kenya, actually the entire country, Western Kenya, and then also Coast and Central Kenya. And what they did was they came up with work plans about how they're going to engage their communities, how they're going to use their services to talk about COVID-19 and the vaccine uptake, And it's this type of information that we need. Because sometimes people don't go to the hospital. So you might not get that data directly from the hospital. But if there are systems that exist, you're already working with religious leaders who are paying attention to the society. You're working with community healthcare workers. You're working with chiefs. You can be able to report outbreaks much faster, and that can be processed, and we can be able to start preparing for a response.
All right. And I get where you're coming from, the advantages of using AI. As you mentioned earlier, it complements what we already have. But speaking of that, you know, and AI in general, do you think that the country, especially Kenya, has enough policies to strengthen the use of AI? Henry, is that?
Yeah, so that's a tricky one. And I'll tell you that, like I've said, there are two parts to it. There is the technology that processes the data. Right now, we have the Data Protection Act of 2019 being implemented by the ODPC, right? Which is quite a law that comes in to actually regulate how, especially when we are able to process data in large amounts. I think we really need to think how the regulations surrounding it. Yeah, but there are also other regulations in the country that used to regulate the health sector, the Public Health Act, and so forth, that have clauses that touch on data utility, right? And so I'll let Sam pick on.
He's the guru there.
I think we need to strengthen our legal frameworks around artificial intelligence. Because it is new, because it is experimental, there's so many things that could go either wrong or right within those processes. And when you look at other countries and other regions like the European Union, they've already passed laws around artificial intelligence. It's not leaning towards the health sector, but it's leaning towards protecting the users and protecting the people. For example, those laws are social, what do you call it? Social ratings, whereby AI is used to give you a rating on how you live your life based on debt, based on lifestyle, health, such things. So they're anti that. So we need laws that will be able to ensure that even as we continue to progress as a country, no one will wake up one day and decide that I can be able to police everyone in this country using artificial intelligence.
And you know, you mentioned a very important thing, protecting users and people. Considering that data collection involves people, you know, that's the initial stage, as Henry mentioned, you know, there are different stages to it. How then do we protect our people even as we try and collect the data? Henry, maybe, is it a loaded question?
No, I think you can go first.
Yeah. And I already touched onto that we understand that data belongs to individuals. I think the Act is really clear on that. And so as we process this data, I think at least we are able to reflect and say, okay, how do we want to intend this? How do we intend to use this data? Is it for the better good, or is it to cause harm? And so And so when we already have these regulations in place, I think at least we are able to do that. The challenge is this, and we know from any other space, that policy is always playing catch up with technology or with anything else. And so there's always going to be, technology is always going to be a step ahead, and then regulation will always come to catch up. Such that you cannot regulate what does not exist. You cannot say, no keeping books on this table if this table isn't even here. So the table has to be there before we are able to regulate. But the problem with especially Kenya, and I keep on saying this, is we are never short of policies. We have so many policies. The problem is implementation. So even as we talk about, you know, getting policies that protect the people in terms, when it comes to data collection specifically, how do we implement it to the, you know, cross all the T's, dot all the I's as it's supposed to be?
I think it's important that we are able to, we don't like using capacity building these days, we say capacity strengthening. It's important that we capacity strengthen Kenyans to understand their rights when it comes to data, and help them understand exactly how this data is going to be used, who's going to access this data, because the honest truth is information is the oil of this century. Information is power. So if someone has access to your medical records, the number of things that they can predict about you is insane. So there is definitely a need to protect people and their data. And for that to happen, they need to understand how important their data is.
Yeah.
Yeah, and that's what we are trying to do as NGOs and as civil society.
And so it's all about building trust.
Yes.
So how do you think policymakers can help address these issues so that they can build trust to our citizens, especially when we have such a data collection hub in place? I know there are several, but this particularly.
Okay, so I think it's always engagement, and more engagement, because if you think about it, people need to know what their data is being used for, right? People need to know why they're giving up their data. At least you have the right of saying, okay, I'm not volunteering this information anymore.
Yes.
People need to know that even as they volunteer their information, it's going to be safe. It's not going to be used to harm them, because there is also potential for that. And so it's more on the mischief of individuals rather than the mischief of the technology itself.
And speaking about the mischief of individuals, if I can just take it back, I know this is not AI, but you remember when we used to use those what are they called, the forms, the data collection forms. People would write different things that are not really what it is, different answers just for the sake of it. How do we ensure that the data that we collect is accurate?
Yeah, so we've been, that's really interesting.
That's interesting.
Let me interest you. So what we now call the data science programs at APHRC was initially called data measurement and evaluation.
Okay.
And at the core of that was data quality. Was data quality. There are so many other avenues of benchmarking data. You can always look at, we call them the validity measures. You can do some internal or external validity. I'm afraid I'm going technical here.
Yeah, it's okay.
So you can do some external validity with government. So say you are collecting data in an informal settlement in Nairobi, say Viwandani, and then you say you've interviewed 150 women, and yet according to the government records there are only 100 women. And then you can start asking questions there. Let's say you've based on the data you've collected, there's someone within Viwandani who, a couple of people, let's say 100 of them, who are making 500 Gs per month.
Yeah.
And they're living in informal settlement. These are external validities. We look and say, how likely is this to be true? And then we could start asking questions there. And so what I mean to say is that there are so many technical measures that are always in place to look at the quality of the data. I'll tell you, there are institutions out here that have collected data, have done some tests on it and validity tests on it, internal, external, and realized that this data is not true, cannot be true, right? And then they've not used that data ever again.
Yeah.
And so there are technical measures that are always in place. As researchers work, they are not only analyzing the data for output, but they are also analyzing it for quality.
Okay.
Yeah.
Sam, even as you add on to that, maybe you can add on and say and answer this question as well. So then, how do we ensure AI? Because clearly AI is here and it's here to stay.
It is here.
Yeah. Maybe we have gotten it a bit late, but it's here to stay. How do we ensure that all we have enough access to ensure that healthcare, especially AI has, wait, what am I saying? What I'm trying to say is, how then do we ensure that we have enough AI technology to help the healthcare system in general?
Two things, policy environment and financing.
It's that simple.
It's that simple. If we have a good policy environment that allows investors to come in, put in money, they're able to get their product out, sell it, make their money back, then you're encouraging people to invest more in this technology. So we need to have a good, robust policy environment that allows people to invest in this space. Because also what we want is a lot of private sector investment. Because and the truth is, you find that a lot of people behind a lot of the research are private investors. So you want to create an environment that will allow private investors to come in. And then the second thing is money. Money will never be enough. I don't think there's a day we'll ever wake up and say we have enough money to do A, B, C, D. But ensuring that the money that is there it's being efficiently and effectively used for R&D. Once you have those two things in place, then you will find that even access to AI and people being able to scale up their interventions or being able to come up with new interventions, it becomes easier and it becomes faster.
Okay.
Yeah. But also, if you think about it, there's that need of the interest, I think, from the funding perspective, but also from the implementation perspective.
Yeah.
And with this, I think we can never be grateful enough for IDRC and CIDA for enabling some of the groundbreaking AI platforms that we are implementing. We can never be grateful enough for them. They've really made it possible for us. But then on the part of interest, I think there are a couple of institutions within Kenya, APHRC and partners, but also outside of Kenya. I think I could mention a couple of institutions in Malawi, Meru, for instance, that have walked this distance, and they've indicated that this is possible.
Yeah.
Right now, what we're trying to demonstrate, I think, is to show that it's possible within the continent. In fact, it is possible, and even so within the continent, and even so done by us Africans, ourselves. So yeah.
All right, enabling. Is the key word I got from that. Because, you know, Kenya has talent. There's so many people out there who are developing softwares, but it's, where am I placing this? Where am I taking this to? That's the problem. So enabling. Yes. We need to have enablers and investors in general. Yes. But even as we, you know, talk about enablers and investors in general, I want to know, so you said there are different stages to the hub and the data collection process of it all. Once it's, okay, maybe we should start from there. Do you know the different steps? Can you maybe elaborate? So at first, you said contact to the person, yeah? Then what next? Sam?
I will let the researcher take
Okay.
Okay, so 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 for Inspire Pitch, so what has happened is this. During COVID, a lot of data was collected with government, hospitals, institutions, other research institutions, and so forth. And so we did not start at that point of data collection, right? But then we realized that there's a process that was behind this. That even as we are going to ask for data sets from the Ministry of Health, for example, as we go to ask for data sets from other departments in the universities, we realize that there are processes that took place. There are health facility records on testing, on people who came in, got tested. There are a couple of information that were collected, and this is where the data is available from, right? Yeah. And so this is the data we are using to train the platform. Okay. Yeah. And so we have this data set, and so you've picked data from the different sources. There's always the use of synthetic data, the alternative of synthetic data, generating data, the machine generating data on itself based on some key parameters that have been fed in. Okay. That is also possible. And so you've picked data from different sources. Let's say real world data, and you need to bring this data together. Yeah. You realize how let's say APHRC collects data on COVID is going to be different with how, for example, the Ministry of Health did that. And so there's a process called harmonization. So the process of harmonization is trying to make variables that are kind of similar be able to be really similar. And so if I had defined age to be between 15 and 20, and you had defined say 15, 20, 20, 25, 5 years span, and someone else had done it in 3 years, we find a way of harmonizing that to be able to fit in within the same variable. And so here we come. So here we've used. So there is the observational OMOP, observational medical records. They have already set standards on data harmonization. Yeah. And so the OMOP has a common data model, what we call OMOP CDM. And so using this OMOP structure, we've been able to harmonize data from different sources and put it as one, right? And so once we've done the data harmonization, the data now it goes through the system itself. Generally, for the system to learn and see, this is what has been going on. And it's not only data on the vaccinations or only data on the treatment, it is everything. Yeah. And so so this data goes through a system, and then that processes it and tries to generate a useful information out of it. This process is so in fact from the harmonizing part, it's a really painful and tiresome process. I think that's where the real work goes on. And then there is the part now the data goes through the machine, and then the machine tries to process it, but then there is also individuals behind who are trying to see what outputs the system is giving us. Is this valid based on the data that we've fed it, and so forth, right? And then there is the output part of it. And so for Inspire Pitch, we've used the Atlas platform, which gives visualization on whatever indicators of interest that we are interested in. And so we can easily see if we are interested in age, how different was it across the age, across the sexes, across the different populations. And so that is the entire process.
All right. Makes sense. Now I have a better understanding. So because you know earlier on you said you've worked on a number, TB and all that. I would assume such data then goes to policymakers and it's supposed to help with decision making. Are there any instances where data has been taken but nothing has been done on it?
Well, I don't have a specific example in mind. But you find that these policies and guidelines, sometimes they take time to be implemented because of one or two reasons. So what we are supposed to do as a civil society and as NGOs is to follow up and ensure that at the end of the day, the policy is implemented and it is being followed up upon.
So how is that process?
The good thing is the government of Kenya, the Ministry of Health, is very, very open and works very closely with civil society. So we normally have consultations with them to talk about certain policies, to talk about very specific things. So let's say even, for example, we are doing this particular program with them. We'll have roundtable discussions with them. We'll ask them. They will give us updates. They will tell us some of their problems, because you find that sometimes they can't raise the issues from within the ministry. They'll come and tell us, there's an issue here. Please make some noise, and then change can be done. So it's a very collaborative process.
And AI, everything good, there has to be challenges. You've talked about some of them, but apart from the issue of trust, mischief in the data itself, or the people giving the data, what other challenges do you face, especially in research and data collection?
I think it's always been about data accessibility. None of this is possible without the real data, right? And although data is out there, there are limits to how to access that data. It's of late there's been a little more success. But then we could do much more as a country. We could make it possible for any researcher, as long as they've demonstrated that whatever they are doing is of interest to the country, to access this data. This data can be made public. And so that brings me to the other point on Inspire Pitch, but generally the data science space. Is that if you think about right now we have, I don't know the exact, but they estimate the overall data generated on the platform. I think in 2020 that is estimated to 64 terabytes, I think, or something like that. And they say compared to 2015, that was like 3 times. So if 2015 was 100%, this is 300%, and this is a lot of data that's out there. But then the question is this data findable? If someone was to look at it, if I were to employ, so imagine that amount of data. As a human being, I cannot go say I'm looking at it on the internet. I cannot sit there and start searching for it. Clicking link by link by link, and so people have used machines, it's still artificial intelligence, in trying to extract this data. But then if this data is not machine readable, if the machine can find this data and not be able to read it and understand that it is the type of data it is looking for, so this data can no longer be findable. right? And so, and that's another challenge, that the data might be there, and we might never find it. It's really useful data.
Yeah.
It's in a format that the machine can never read. And so because the machine has given me 10,000 data sets, that's a lot. I'm like, okay, this is enough. And so very useful information will always remain there. And so as an effort within the data science program at Aphrc, we're trying to make data fair.
Okay.
So we say it's findable, accessible, interoperable, and reusable. So we're trying to make data fair. So it's no use if you spend a lot of money in collecting data and processing it, but then it's not reusable.
Yeah.
So we can say it's a work in progress.
It is a work in progress.
Okay.
Yeah. So it's a work in progress. It is a lot of work in progress.
But we'll get there one step at a time, right?
One step at a time.
Okay. Yeah. Then some coming to you then. So looking at AI and how it's developing really fast, what impact do you think it will have in the future when it comes to service delivery, especially in the health sector?
My focus will be on diagnosis.
Okay.
Because I am a victim of misdiagnosis, and I have a very close friend who was misdiagnosed for years, and she ended up taking steroids for years without knowing. So what ideally AI should come to do, especially within the healthcare sector, is to aid in diagnosis. Doctors are usually required to cram a lot of information, and to be honest, they are prone to make mistakes because they are human. But if you have an AI tool that is complementing a doctor's work, then you find that now it will be we'll be able to have more accurate diagnosis of diseases.
Yeah.
So that means that you won't be told 4 months later that you are now in stage 3 of cancer, and yet you were in stage 2 and no one figured it out.
Yeah.
So looking at diagnosis, but also there's treatment, in that for people who have chronic illnesses, it can help you be able to manage your illness. It can remind you to take your medication. It can remind you to look at your diet. It can remind you to stay active. It can do a number of things that can be able to improve the quality of life. And then more importantly, and I know he'll talk about it,
the research in the health,
is being able to predict diseases before they happen, because more often than not, you're predisposed to a number of things. Your lifestyle will predispose you to issues. So if there's a way that you're able to take this data from your day-to-day life and your health data and say, based off of how you live, you are more likely to get this, so you need to make these changes, then it will mean that you're able to get accurate suggestions as to how to improve your life and your health.
All right. Early detection, diagnosis, and treatment was his. What about you?
And now think about it. Right now we're talking about diagnosis, right? And we're talking about treatment.
Yeah.
But then if we are able to curate and use artificial intelligence really well, we should be in a position that we are talking about prevention rather than treatment. And he's touched on it already, that think about it, if you can relate population data, if you can relate your data on what you purchase, say you take a pizza a day, and you never get off your seat, and so forth.
You're not healthy at all.
And you grab a beer every evening at 6 p.m. If you can relate this data, and we relate this data with data that's already at the health facility on you, and say, okay, previously you've been diagnosed with 1, 2, 3, and 4 conditions, right? And then we are able to see, okay, given this, you are likely to suffer from this. And so we do not need to wait until the point at where now we are treating. We should be able to now
prevent.
We should be able to prevent.
Yeah.
Okay.
Yeah.
All right.
And this is possible if you think about the smartwatches that.
It's true. The apps.
Yeah.
We have so much.
They'll remind you to stand, and that's just the start of it. I think there's a lot more that could be done with that. Okay.
And do you think Kenya as a country has enough manpower to enable that?
I don't know about the manpower, but I know we have the brains to do that.
The brains, yeah? Okay. Yeah. I'll give you a parting shot, 30 seconds each. You can start with yourself.
Parting shot.
Yeah.
I think I'd say that as you continue to live your day-to-day life, you need to pay attention to what is going on around the world. There are a lot of changes that are coming in, and it won't be optional for all of us.
Yeah.
As Africa, it's not optional for us to embrace technology. So the sooner we embrace this technology, the sooner it will work for us.
Okay. Henry?
Yeah, as Africans, I think we first have to understand that technology, artificial intelligence, machine learning is here to stay. And we have to make an informed choice on whether we want to get into the age of technology as a backbencher or get in. Remember, during agrarian revolution, during industrial revolution, we've always gotten onto the platform a little later.
Yeah.
And we've cried foul, we've said we've been disadvantaged. But then this is an emerging field. This is a field that's just started. So as a continent, as a people, we have to choose whether we want to join in the bandwagon and do this ourselves, or we want to sit back and wait and see what happens.
All right. I think I've learned a lot from AI today than I have in my life. So thank you so much, gentlemen, for that. We had, of course, Sam Makau, who is the Communication Chair, Coalition for Health Research and Development, and Henry Owoko, who is a Monitoring, Evaluation and Research Officer and Data Protection Officer at APHRC. And I hope you've learned a thing or two. That's all we had for you here on News Center. Thank you so much for your company. I'm Ashley Mazuri. I'll see you at 1 p.m.